Hey, what's up, guys? Thank you so much for tuning into our channel and welcome to another episode of Insulink Insurance Podcast, where we talk about health, lifestyle, and insurance. My name is Masio Cheno. For those who don't know me, I am your host on this podcast series and also a director at Insulink Kenya Limited, which is an insurance agency. So, for all your insurance queries and concerns, kindly reach out to us through the contact information shared on the description box. We are going to talk about endometriosis today because March is Endometriosis Awareness Month, and we're going to have two sessions. One session with Esther Kimemia, who plays a key role in creating endometriosis awareness and is also the founder of Yellow Endoflower. On our second session, we are going to hear from Dr. Charles Muteshi, who, apart from being a gynecologist, is also an endometriosis and fertility specialist. Let's tune in.
So, Dr. Daisy, we just get into it so that I don't also take much of your time.
Absolutely. Actually, I'm already in clinic.
I see, I can see that. So, kindly introduce yourself for our viewers and listeners.
Yeah, so I'm Dr. Charles Muteshi, an obs-gyne and subspecialist in reproductive medicine. And I have an interest in endometriosis and fertility. So my work at Agha Khan University Hospital involves mainly fertility treatment and management of patients with endometriosis. But of course, I see other gynecological conditions.
Okay, that's great.
Yes.
So in simplest or in layman's term, what is endometriosis?
In the very simplest terms,
Yeah.
endometriosis usually means that you would find areas of the body that is not the womb lining containing cells that are similar to the womb lining.
Yeah.
The womb lining is the uterus where girls would menstruate or lose blood every month.
Yeah.
So when those cells are found outside of that womb lining, then we call it endometriosis.
Okay.
They may be within the pelvis, but they can also be outside the pelvis. For example, in the belly button or the navel, could be around the chest or in the lungs. So those are some of the commonest areas where you find endometriosis.
Okay. Do you bleed in these areas as well?
You tend to have tissue breakdown. There might be bleeding. So girls will tell you, for example, those who have belly button endometriosis, that every month they have a period, they see a bloody discharge from their navel. So there is associated bleeding with the periods.
Okay. Okay, great. So what are some of the common symptoms that we should look out for?
Endometriosis is not very easy to make a diagnosis of by basing on symptoms alone. However, you can have a suspicion that possibly there is endometriosis when periods are very painful. Sometimes the pain is excruciating, sometimes the pain is mild. So the degree of pain does not necessarily define the likelihood of endometriosis. The other symptom would be pain around the time of your periods when you use the toilet, for example, opening the bowels or going for a short call. There might be bloating or feeling tummy upsets around the time of your periods again. So these symptoms tend to be what we call cyclic, or they are predictable and coincide mainly with periods. There could be chest pains that also come with periods. There could be bleeding from the belly button, as I said before, which are always coinciding with periods.
Okay.
Now, pain is a predominant symptom, and it may occasionally happen around ovulation or even throughout the cycle, depending on the type of endometriosis that one has.
Okay.
Occasionally, older girls who are trying to get pregnant may find that there is delay in conception. There is a link between endometriosis and fertility, although it's not direct.
Yeah.
So it doesn't always mean that if you're not able to conceive immediately, it could be endometriosis, but it could be connected because it's predominantly a reproductive organ kind of condition.
Mm-hmm.
Because, as I said in the introduction, endometriosis is the presence of cells that look like that of the womb lining. So the womb lining is designed to carry a baby for pregnancy. And when these cells are elsewhere, then it means that there could be an association or link with fertility, particularly if it affects the ovaries or the fallopian tubes.
Okay. All right. So is there an age limit? Who is more at risk?
We think that all girls of all ages and older ladies might be at risk of endometriosis. We possibly still do not know exactly when the disease starts or manifests itself, but what is known is that there is a long delay in diagnosis. So most ladies will find they've had a diagnosis of endometriosis in their late 20s or early 30s. But when you go back into the symptoms, they'll say, I had period pains right from the beginning of the period. So we know endometriosis affects younger girls who are adolescents, and it does go all the way into the age of the menopause.
I was having a conversation with Esther, and I told her growing up, we had classmates who would have very serious menstrual pains, and they would even miss classes. And this is something that started right from the beginning when they started having their periods. And they would be told it's normal, take a ibuprofen or take some Panadol and you'll be fine.
Yeah, it's a common theme. And unfortunately, it is something that is not thought about very early. And when you go to the doctors at that age, because they may not find very typical symptoms, most girls are either dismissed or told that perhaps, pain is very common with ladies, so they just need to put up with it. But it's true, lots of girls who have endometriosis will have experienced such excruciating symptoms from the beginning.
Yeah. Now, my question is, how do we get this kind of conversations to the girl child in high school or even primary? Because I know girls who start their periods at around 9 years old. But because they have experienced this before, they think it's normal.
Yeah, fortunately, reproductive biology is now introduced in most curriculums across the world. There are areas where they've done piloting, particularly in New Zealand, for example, where the curriculum involves teaching girls what is normal menstruation and what is not normal, and what to expect. And when this is introduced to them early, it's actually been seen on follow-up that those who have abnormal menstruation, which may be in terms of either flow, regularity, or pain or other symptoms, tend to come to their general practitioners earlier. And also, when you educate the doctors at that level that please think about endometriosis, these patients these girls tend to actually come over to the specialist sooner, or they are given effective treatment early. So we are hoping that as we learn from other jurisdictions that have instituted such educational initiatives, then we can borrow from that. So we don't have to reinvent the wheel, but I'm aware that we are also doing a bit here to try and sensitize the public. We are not a homogeneous society, so there might be cultural biases and other things that could slow down the efforts, but certainly I think we are in the right direction.
Okay. What is the diagnosis process and the treatment plan for endometriosis? I understand different types and stages as well.
Yes, absolutely.
Okay.
So the way we approach patients who may come with what could be considered as endometriosis, will be to look at their general history, their kind of profile, to determine whether there is risk for any other condition that is not endometriosis, though mimicking endometriosis. So if there is pain in younger girls, you want to make sure they do not have an infection, particularly bladder infection, sexually transmitted infection if they are sexually active, if there is no cyst on their ovaries. So you will do basic tests like checking the urine, screening for infection, doing an ultrasound scan to look to see if there are cysts, exploring symptoms to do with the gastrointestinal tract, just in case, it could be their bowels and not necessarily endometriosis. So once you have kind of worked through that and excluded other possibilities, then it is sensible to make a presumptive diagnosis of endometriosis. And what that means is that you would say, we are likely to be dealing with endometriosis, and we will start you on some treatment for the next 3 months or so to see how then you respond to it. If it works well, then we can carry on with that presumptive diagnosis of endometriosis, because at the end of the day, you want the quality of life to improve so that activities of life are not interrupted unnecessarily. These are young people who might be going to work or school or involved, obviously, in community work and other bits. So you want them to be productive at that stage. There are times when this approach may not work 100%, and then you have to move to the next level and say, well, we've tried maybe treatment with a pill or painkillers, and they don't seem to be working as well as we like. Then the next thing would be consideration for what we call laparoscopy. We know that laparoscopy is the best way to make a diagnosis of endometriosis, but is also one of the ways in which it is treated. So where laparoscopy is considered, then it must be done in conjunction with a doctor who has an interest or special understanding of endometriosis, because when you find endometriosis and you remove it effectively, then there is now growing evidence that will have a longer lasting effect on controlling of symptoms. If, of course, there is need for laparoscopy and the skill is probably limited, then at that point, one could make a diagnosis and not do much and refer to the right specialist. But that has to be discussed with the patient prior to going to theater, so that there is a common understanding that this is what we may do and this is what we may not do. There would be occasions when pain could persist even after doing laparoscopic surgery, and it doesn't always mean that the treatment is failed. It means we have to look at other possible causes. As I said earlier, there are different mimics of endometriosis symptoms. So some ladies will have endometriosis which sits without causing symptoms. And if you find it and they have pain and you think it's entirely due to that, you may find removing the lesions actually doesn't take away the pain. So you have to think about other causes. And in that case, you have to explore things like maybe pain from compression of nerves from the spinal cord, maybe due to muscle injury or stuff like that. So we look at a very comprehensive approach, and the treatment journey usually has to be planned. So you're not coming in and going away and saying, we have had your surgery, off you go. You make a plan and you follow it through, and you give allowance for possibilities of various outcomes and say, if this works this way, if it's good, we will continue with this route. If perhaps it's not as effective as we wanted it to be, then we might maybe divert a little bit and explore these other options. And that's the reason why we would prefer that in the ideal world, you have referrals to endometriosis centers, because in that kind of hub, then you can be able to signpost patients in the right direction, and working very closely with their general doctors, then go back and say, this is what we've done and this is what I would like you to do. And the patient being able to manage their own condition, because they are at the center of it. We give them the options, but they choose what they would like to do. It becomes much easier.
Okay. So does it mean that any gynecologist can give me a diagnosis, or it has to be someone who has a specialty in endometriosis and fertility issues?
A general gynecologist may be able to diagnose endometriosis. So you don't need to be a specialist in endometriosis to make the diagnosis.
Okay. All right.
Yeah.
Now, I wanted to talk about endometriosis and fertility, but you already touched on that. Is there anything else you'd like to add on the side?
Yes, just briefly, that not everyone who has endometriosis would have problems conceiving. So majority of girls who have had a diagnosis of endometriosis will be able to be fertile and carry their pregnancies normally. But we do know there might be slightly lower pregnancy rates in those who have endometriosis compared to those who do not. And how much this is affected will depend on the extent of endometriosis. So we have different stages for endometriosis. We have stage 1, stage 2, stage 3, and stage 4. Okay. The stage 1 tends to be very mild, and perhaps there is debate as to whether that actually affects fertility. It might. Stage 4 is when there is extensive endometriosis, and this will affect functioning of the tubes or functioning of the ovaries. Okay. So when you have endometriosis with fertility as a priority area, then normally the approach would be that if you've tried for at least 6 months and it hasn't worked, then the best treatment option in that case would usually be to consider laparoscopic surgery to assess the tubal function and correct any distortions that have been caused in the pelvis by endometriosis. But it's always important to remember that when you're dealing with fertility, make sure you have excluded other problems that might be associated with your male partner before you go down the route of surgery.
Okay, so does it mean that surgery is the only way to go when it comes to treatment?
Not at all. And the current recommendation is that we shouldn't rush to surgery, partly because of 2 reasons. One, the delay in diagnosis has meant that people have waited for laparoscopy when they indeed may be long waiting list or they're not able to afford surgery. And the second thing is that if surgery is considered, then it has to be done by someone who is very competent in doing surgery for endometriosis. So you may have a presumptive diagnosis or a diagnosis based on ultrasound or MRI, and medical treatment is started. So you don't always need to have surgery for treatment or for confirmation of endometriosis.
Okay. Endometriosis and the teenage girls. How do we ensure that we connect with the girls and we know what they're going through? Like, how do we create awareness?
Normally,
parents,
because
guardians.
Yes, because they're usually under the guardianship of their teachers and parents, it's helpful to create awareness at that level first. So, letting the teachers know what could go wrong with menstruation. And then once they understand that fully, the girls are then told or informed what endometriosis is. And if they suspect they might have symptoms that could be related to endometriosis, to see their doctors who could refer them. Now, they don't always need to have surgery. And most times with teenage girls, we will start medical treatment. It is not easy that a girl might be on medical treatment for the longer term. And, they may forget to take their pill for various reasons. Obviously, school is not without its own challenges. Yeah. They may also feel they are different from their friends who are not taking anything, so they could decide not to take their meds. They could also be kind of stigmatized or ostracized by their friends or other people, or people might start asking, why do you always have to take something? So that becomes some of the challenges that we are faced with. So having these public conversations and letting everybody know that endometriosis may do this and this is how we go about it, removes such barriers.
Okay.
We also know that whereas endometriosis is predominantly a female condition, making the boys aware helps a lot, because then they would understand what's going on. If someone is writhing in pain, then you don't think what could be going on with her. So the information about endometriosis is not limited to girls alone.
Yeah, that's true. Okay. So I think people need to understand there's no known cure for endometriosis as we speak.
Yes, and that's part of the reason we don't always emphasize surgery, because as I said, it is very helpful that if surgery is to be considered, then it has to be done by a doctor who is well versed in surgery for endometriosis. There is no point having suboptimal surgery, because that tends to create lots more problems than not operating alone. So in my practice, for example, we do surgery, and sadly, we see a lot of patients who've had multiple operations in the past, which has not been very successful. And this creates a lot of frustration, and it doesn't make the operation very easy, because if you find someone has had 5, 6, 7, or even 10 surgeries, then everything is in a mess. So if surgery has to be considered, then it must be done by someone with good skills in endometriosis. Of course, we are aware that it requires a bit more training in the area of endometriosis surgery, and we do not have too many people around who've had this type of training. We are glad that there is mentorship programs and people have an interest in this, and so the numbers are increasing. And we also have doctors who are able to get access to specialists, and they will refer patients or discuss patients with the specialists with view of doing joint surgery. So that's one of the things that has happened in the last few years, that patients now have access, to definitive treatment locally.
Okay, that's awesome. Do we know any cause for endometriosis?
We haven't discovered, and maybe we are not clever enough, but it's just because it's a condition that is difficult to study or replicate, because the human reproductive system is unique. So we don't have a lot of animal models that have a similar reproductive system with menstruation that we could possibly study very well what endometriosis is. There's been a bit of few theories around, and the biggest theory is whether menstruating through the tubes into the pelvis can cause endometriosis. We do not know whether that is true. It's kind of the egg and the hen kind of situation. Is it that the periods get into the pelvis and cause endometriosis? Or is it that endometriosis is just there, but the periods get into the pelvis? So we haven't yet conclusively discovered what causes endometriosis.
Okay. All right, Dr. Ari, I think that brings us to the end of this short video. Do you have any parting shots regarding what we just talked about?
I think my challenge has always been to everybody to try and understand endometriosis, and then to go to 2 or 3 of your friends and ask them, do you know endometriosis? And if they don't, then you would want them to know from what you know. Yeah. And then ask them to also challenge a friend or 2 that, do you know endometriosis? So in this way, we would be able to create more awareness and understanding, and make this condition that has remained silent for a long time to be known.
I must commend Essie for what she's doing. She has created such a great platform on her Instagram and Facebook. The yellow and
It's
the
impressive.
brown.
Yeah.
Yeah.
Absolutely.
I learned quite a lot from that platform alone.
Great. Thank you.
All right. Thank you so much for joining us. We hope to have you on board to talk about other things other than endometriosis as well.
You're most welcome. Yes.
Okay.
Yeah.
Thank you.
No worries. Thank you. It was a pleasure.
It was a great pleasure from my end as well. So do have a great day.
Thanks. And you. Bye now.
Bye.
If you have watched up until this point, I want to say thank you for tuning in. I hope you've learned a couple of things. Please ensure that you do subscribe and like this video. Also, turn on the notification key so that you don't miss out on any future content. Now, ensure that you share this link with your loved ones, including the boys, not only the girl child, because we all need to know what endometriosis is. So spread the word, share this link on your social handles as well as your WhatsApp group, and let's help create awareness. If you haven't caught up with our previous episode, which was on lupus awareness, I would highly recommend, because March is also autoimmune disease awareness month, and lupus is an autoimmune disease. So please ensure that you check out the previous video as well if you haven't caught up with it, and share, subscribe, turn on the notification key, and I will see you guys on my next video. It's been a great pleasure. Until next time, guys. Bye.